Welcome to Project First Line, and thank you for joining us. It's so great to have you all here today. We'll meet today for about 20 minutes to discuss the concept of risk recognition and how you can apply it to help prevent infections in healthcare. We'll also have an opportunity to reflect before we wrap up for the day. For today's agenda, we'll cover recognizing risk, how healthcare is different, where is the risk for germs to spread in healthcare, and then we'll bring it all together and conclude out today's presentation. The learning objectives for this presentation will include understanding the concept of risk recognition, especially in healthcare, and also applying the concept of risk recognition to infection control actions. So we'll start first with recognizing risk. Thinking about the question of what risk is and how you recognize it, can you think of a time when you spotted a risk at work or at home and you took action to stop something bad from happening? And how did you know it was a risk? Had you seen it happen before? Or was it something you were taught? Feel free to jot down your thoughts in your participant booklet. I would also like to share some examples to stimulate ideas of risk. How about intervening when a toddler tries to climb up on a table? Or slowing down when you see a dog on the side of the street as you drive by? Also, turning the handles of pots on the stove away from the edge so the pots won't be knocked off. And then lastly, how about wiping up a spill so others don't fall? And as a final example, we've also recognized risk in changing behaviors and actions from the COVID-19 pandemic, such as wearing a mask to the grocery store or avoiding large gatherings and getting vaccinated. I'm sure you all were able to jot down some great examples as well, so thank you. A simple definition of risk recognition is seeing the potential for a problem to happen. But seeing it doesn't mean it has to happen. You all had examples of seeing a potential problem and doing something to stop it from becoming a real problem. And that's important. You recognize risk and you act on it. Now, we'll see a brief clip of these ideas in action. Note also that we recognize risk all the time in our daily lives, and we act to keep bad things from happening.
You deal with risks every day at work. Think about times when you're mopping up a spill, checking a medicine dose, or when you see a wobbly patient about to fall. You see a possible problem that could hurt a patient, and you take action. You can use this same process of recognizing risk when it comes to infection control in healthcare. If you learn to spot the opportunities for germs to spread, then you can step in and take action to stop the spread of germs. So why are we so focused on germs in healthcare? The risk for germs to spread is different than it is at home and in the community. There's a higher chance for germs to spread in healthcare settings than, for example, a grocery store, because it's where patients who are sick come for care, and patients who are already weak or ill are likely to be more vulnerable to infection. Healthcare is also unique because some of the things healthcare workers do as part of giving care can put patients at risk of infection, like starting an IV. Sometimes we are the opportunities for germs to spread. We interact with a lot of people throughout the day. We touch a lot of things, and we use many different kinds of equipment. And these are all ways we can spread germs. All of this is why we have to think about infection control in healthcare differently than we think about infection control in the community.
The concepts of recognizing risk when we're at work in healthcare, like seeing the potential for a patient to fall down and stepping in to help, also apply to infection control. When there's a risk for germs to spread, you do certain things, like clean your hands before giving a patient an injection, put on PPE before doing certain tasks, and clean and disinfect high-touch surfaces like door handles and light switches. Thinking further about the idea of recognizing risk, can you also think of times at work when you recognize the risk for germs to spread? What have you done to stop germs from spreading before they caused problems? Let's take a look further at how healthcare is different. When we think about germs spreading in healthcare, it's helpful to remember what makes healthcare a unique setting with unique challenges for risk for infection control. We think about germs and their risks differently in healthcare than in other places, like at home or in the community. Why is that? Patients are coming in for care, so there's a higher chance that they have an infection. Because many patients are ill and weak, they're likely to be more vulnerable to infection. So the risk from germs spreading to them are higher. And sometimes the things that we do as part of giving care can actually put people at risk of infection. If a patient needs an IV, their skin has to be broken. If there are germs on their skin or the needle, inserting the IV can push germs into their body. And finally, the work that we do in healthcare brings opportunities for germs to spread. We usually have closer interactions with patients during care than people have in the community. We interact with many people, and we touch and share a lot of things and equipment throughout the day. All are opportunities for germs to spread. That's why infection control is different in healthcare than in other places, and why it's all the more important to recognize the risk for germs to spread throughout our workday. So where's the risk for germs to spread in healthcare? We've talked about recognizing risk in general, and about higher risk for germ spread in healthcare. Now let's work together to identify and discuss some infection control risk. The next 3 slides have pictures of common scenes or situations in healthcare. Please look at the picture and identify the risk for germs to spread. You can jot down your ideas in your participant booklet. What do you see in this scene? Definitely, this person looks like a patient, and they look like they don't feel very good. What risks do you see for germs to spread? They have a mask on, but they seem to have a runny nose. What other risks do you see? Other possible risks include the patient appears to have a respiratory virus that could spread by respiratory droplets. Even though they are masked, germs could also spread from the patient to surfaces in the waiting room. The patient could also touch surfaces in the waiting room that have germs on them and spread those germs to themselves when they wipe their eyes or blow their nose. I'm sure you all were able to jot down some great ideas, so thank you. Let's look at another photo. What risk do you see here? Some possible risks include, even though the patient looks healthy, their wound is not covered, so drainage is not contained. Germs could be spread from the patient's wound to surfaces in the waiting room. And also, germs from surfaces in the waiting room could reach the patient through their wound. There's no patient in this scene. But is there an infection risk? How about the uncapped needle sitting on top of the trash is a risk? Someone could get stuck with it, and germs on the needle could get into their body. What other risk do you see? Additional risk may include a sharp and a regular trash can instead. Additional risk include a sharp and a regular trash can instead of a sharps container. Also, an overflowing trash can, which is an infection risk, if it contains items like used tissues or other items carrying germs. The supplies placed near the sink, which could get splashed with water that contains germs. So let's bring it all together. You did a great job today recognizing risk. Now, as you reflect on the infection risk that we've talked about or identified, think about your next workday. Can you recognize one risk for germs to spread that's part of your daily work? Let's go one step further. When you recognize one of these risks, what's one thing you can do? One infection control action to help stop germs from spreading. Please jot down your thoughts again in your participant booklet. That will conclude this presentation. Key takeaways from today's presentation are: risk recognition is seeing the potential for a problem to happen. And you can help control infections in healthcare by learning to recognize the risk for germs to spread and cause infection and not letting it happen. Also, that healthcare is a unique setting. We consider germs differently in healthcare than we do in other places. Thank you all so much for your time and attention today. I hope that you can take these ideas and apply them at work. Even though we covered a lot today, there is still so much more to learn. You can keep exploring these topics on your own using the resources on this slide. Project First Line has a suite of products to help you learn more about how to recognize infection risk at work, where germs live in healthcare, and also how germs spread. You can also follow Project First Line on social media. Again, thank you so much for your time, and I hope you enjoyed today's session. Please end by completing the feedback form. Thank you for joining us. Have a good day.